but this is just showing you day of the delivery, prep and delivery for the patient. I'm first putting a little layer of what we call glazed liquid to kind of make the surface a bit more slick and reducing the surface tension. You want to be real careful of where you're stopping. So I start applying it near the margin and fade this toward the incisal edge. And this alone, and I have made restorations like this alone is already a great result. This is a polychromatic effect. If all you really needed to do was tone down the brightness or lightness of the restoration, this alone is good enough. Thank you, Helen. Hi, everyone. Welcome to today's office hours. The topic for today will be staining, glaze, and finishing our restorations out of the mill. So I do want to preface all of this by saying the materials that we have developed for the fast mill, they are intended to be used right from the mill, right? Everyone's familiar with the now nomenclature. So no oven weight. That's the processing of our materials. It's meant to be used from the mill to the mouth. And most of them, and I think in most situations, they definitely are suitable for that purpose. But what we're discussing today is taking our restorations to the next level. You know, if you have a more aesthetically demanding situation, I find especially for maybe a single unit anterior where the patient has maybe more aged teeth, more characterization. As you're probably familiar, our materials, even though they're now products, they are monochromatic. So the advantage that characterization provides for us is we can apply additional colors to it. We can infuse translucency effects into these more aesthetically demanding situations. And we can really help our restorations disappear in those more complex cases. So we're going to take a look at a couple cases, and then we'll dive into the hands-on component and how we can achieve really lifelike results with our monolithic restorations from the mill. So the case that will start you off here, so behind our labels here, you can see this was a recent case that I completed. These are 10 BruxZir Esthetic veneers on the upper. So all of the lowers are natural teeth. And so just giving you an idea of where we started, patient originally had some spacing. So diastema between 8 and 9, laterals a little smaller in these lateral views, or rather, I have lateral views next, but you can see where we started. She has spacing on either side of the canines. So just looking at her natural teeth, you can see there is a level of translucency along the incisal edges, along the proximal areas where the contacts are, and just kind of pay attention to where those areas of translucency are located. And I wanted to try to mimic that in her restorations. So this is what we ended up with. Again, BruxZir Esthetic, it is a translucent enough material to match natural dentition extremely well, as you can see here. But these are from the mill, and you can see along the incisal edges and the interproximal areas, we have that hint of blue, a little bit of gray, and that's all through surface characterization, or what we normally term as stain and glaze. And so just some lateral views to see where we started. So that's the spacing you can see along the canine, and the patient was just looking to close that up. So we did minimally invasive veneers out of BruxZir Esthetic. And the majority of my veneers, I would say for the last 8 years, have been in BruxZir Esthetic. It really is just such a beautiful material, and I really appreciate the durability of it. So just another view of the incisal translucency, and there's a little bit of a body shade that was applied to it as well. And I'll take you through exactly the application and colors that I use for Natalie's case here. So here's the left angle here where we started. and where we ended up. And there's a good look at Natalie and her smile. And there's a good before and after. So I would say, before we even get too far ahead with characterization in color, a lot should be, the main focus really is the contouring, right? The beautiful result that we ended up with really falls primarily in the contouring, the design, of course, the planning of where we wanted to take her new incisal edges to, and then, you know, maybe we can revisit this in the future on the design. And really, the staining glaze is just the finishing touches. Could we have achieved a beautiful result without staining glaze? Absolutely, if we had the same foundation. So this is where I think the characterization really becomes important. So this is another case here. Patient had a PFM on number 9, and as you can see, it doesn't really blend very well with the surrounding dentition. Patient is in his 60s, so a little bit more worn, aged teeth, a little flatter incisal through wearing, some gingival recession, but he wanted to change out the restoration for something that matched his natural dentition a bit better. And so we milled out a BruxZir Esthetic. Again, in the anterior zone, I don't shy away from using BruxZir Esthetic, especially even in these challenging situations. We can absolutely characterize this to better match the neighboring teeth. And this was done a few years ago. But again, the design is right on. Right now, for this case, we have the benefit of our mirroring function where we can take the contour of 8 and just flip this over. And I milled out first a bit of a lighter block to illustrate that we can actually darken these down or tone down the shade quite dramatically using just our surface staining glaze or surface coloring. And this is what we ended up with. So I did this in 2 firings. So the first firing was first to lay the colors, to apply the base shade over the entire restoration, because as you can see, I toned down the brightness of the entire block or the entire BruxZir Esthetic here. And then infusing a little bit of translucency effects, as you can see, the subtle bluish, grayish tone along the incisal edge and along those line angle areas. I first want to show you how I applied the staining glaze on this patient. So just providing a couple strategies for you. So I stained this on the patient. So this, after it's milled, sprues off. Before I apply the colors, we sandblast the restoration. So I'll take you through what that looks like. But this is just showing you day of the delivery, prep and delivery for the patient. I'm first putting a little layer of what we call glaze liquid to kind of make the surface a bit more slick and reducing the surface tension. And that just makes the application of the color a little bit easier. So I'm doing if we're sticking to the original name of staining glaze, I'm putting the stain on first, firing it, freezing those colors in position, and then we put a glaze layer afterwards. So after that initial glaze liquid to kind of slick the surface, now I'm applying a bit of A shade, a bit of B shade, a combination of the two until I see the overall hue, the overall color matches number 8. Once the colors are set, now I'm applying a bit of translucency down the line angle. So you can see I'm starting off near the gingiva and just very carefully dropping it along the line angle. And once we go along the line angle, then I'll go across the incisal edge. So where we see these bluish and grayish tones of translucency, it's just simply where the enamel's a bit thicker, right? There's less underlying dentin, which would block that level of translucency and light passing through. Here I'm using a little bit of a light bluish, light grayish tint along the incisal edge. And again, I will take you through the application live in a minute. So once the translucency is placed, you may have noticed there's a little bit of some white spot characterization. There's 3 bands of white that we can see very clearly on number 8. So a little bit at the gingival third or junction between gingival and middle third, right through the middle and on near the incisal third as well. So I like to place the colors first And once I get them in position, now I kind of very lightly, notice it's a really, really light touch of the brush to distribute the colors exactly where we want. So here we want a little bit more of a horizontal appearance to the white. So I'm just very, very lightly touching the surface of the restoration. And once we're done, this is an Optra stick that we use to transfer the restoration out of the mouth. We apply some of our support material for the oven. It's super peg material, and this is what we ended up with. And it's just another view of this restoration. So that's my goal for today, to take you through how we achieve these results. Now, first starting off with finishing, you can finish these restorations, finishing meaning taking the sprue down, contouring. These are just some of the tools that we really like to use here. And the one that I use most often is what you see on the left-hand side. It's from this company, TCS, Thermoplastic Comfort System. It's a green-mounted stone. It's called the green-mounted stone. What the stone is, it's silicon carbide. It's a really abrasive material and very long-lasting. And you can check these out online. They come in boxes of 100 for like anywhere I've seen from $15 to $30 for a box of 100 of these. These work really well. They go into a straight lab handpiece, but I think you can also find these for high-speed applications. But this works really, really well. I'll take you through how we would use that. Then we also have some diamonds. So I do, and have in the past, use a fine grit diamond, like a red stripe fine grit diamond on a high-speed handpiece. That works extremely well to finish the sprue and contour. Obviously a little bit more costly, but you can absolutely use that as well. And what you see here, the Supreme Diamond, something that we use in the lab that our technicians use in addition to the stone finishers for contouring. The third one there, I don't really use that a whole lot for contouring. That coarse grit polisher is used really nicely along the gingival margins, or really along the margins in general, especially for partial coverage restorations, where due to the material thickness protection on the software in the mill, sometimes you get a little bit of a raised area, maybe a little thicker margin than we really would want. This is a fantastic tool to use to finish the margins, especially for the more brittle materials like obsidian or obsidian now. And on the right-hand side, that is another polisher from the Eve Rotary Company. It's a medium grit polisher. So their kits come with like a coarse, medium, and fine, like many other porcelain polishing systems. What I like to use the medium polisher for is to actually tone down the shine from the glaze. So when we glaze these restorations, they can come out extremely, extremely shiny. And I know that looks nice in some situations, especially when the restoration is just sitting on its own. But if you pay attention to natural dentition, you can see that natural dentition is a bit more satin finish. I'll actually just go back quickly to show you. I used that polishing wheel on the restoration after it was glazed to just tone down that shine. If we look at the surface finish of the adjacent every other tooth, with the exception of posterior molar, every other tooth in the anterior zone is a natural tooth. And the finish on natural teeth, when there's no saliva on it, is typically more of this satin finish. So I find the glaze gets a little bit too shiny, and I'm able to tone it down using that medium grit polisher. And I'm sure there's other medium grit polishers out there that would have this effect, but that's the reason I use it. You normally think of polishing as to shine the restoration even more, but I'm actually using it to tone down a bit of the shine. All right, that's where we're at so far. Let's see what else I got for you. Okay, so the system that we're using today, it's this aesthetic system called MIYA. It's from Jensen Dental. MIYA stands for Make It Your Own. And this kit I've used for the past several years, and I've used other systems out there. So far, this has been a wonderful characterization system. They call it liquid ceramic, and they're real careful not to label it as stain and glaze. I know that our topic of discussion is stain and glaze. I'll probably refer to the technique and what we're doing as stain and glaze, but the reason why they differentiate liquid ceramic versus standing glaze is because the composition of this material, you've got pigments in it and you have ceramic with the pigments. And so most stain systems have a much higher percentage of pigment to ceramic. And what the Jensen folks have created here, it actually has a lot more ceramic. So the increased level of ceramic with fewer pigments in it really create a much more, it creates a situation where it absorbs light a lot better and it gives a much more natural appearance because we are just putting a layer of color on the most superficial part of the restoration, but we're trying to create the illusion of depth through the restoration to, again, mimic natural dentition. So I find it works really well. Now, you can certainly still overdo it. So the techniques and what we discuss and how we apply it are very similar to other standing glaze techniques and systems. But I just find what they use and incorporate to work really, really well. So this is what they have available for their standing glaze kit. And I know it's a little bit overwhelming. There's a lot of different colors here. I haven't used all of these different colors and everything that they offer. But what I did use and what I felt would provide, I think, the ability to characterize the majority of situations, a lot of situations, certainly, maybe not 100%, but we simplified the kit a little bit. The folks at Jensen have been really, really helpful for us and allowed us to create a kit that's a little bit more simplified. So from their original kit, we've cut some of the colors down, and this is what we ended up with. So on the top row, you have your A through D shades. So those correspond to the Vita Classic Shade Guide. This is where you're probably going to spend most of your time, because as you are probably familiar with, most of our blocks, they're a little bit brighter, maybe not as toned down or have the warmth that we are sometimes shooting for. So these body shades, A through D, allow you to tone down. We consider increasing the chroma or warmth to the restoration. That's what these colors can do. In the second row there, you see cobalt, slate, storm, and smoke. It's basically light blue, dark blue, light gray, dark gray. These are translucency modifiers. These are fantastic to create that really beautiful incisal translucency that we saw in the previous couple of examples. The third row here, we have some additional colors, so translumen. And by the way, the trans, as you see, it stands for translucency. So some of these colors aren't translucent. The translucent colors allow for this greater depth, and you can see through the colors a lot easier, and it just creates a really nice effect. In the third row, we have translumen. Lumen is a really unique color in that it brightens and adds value to the restoration. And the snow is what I used on that last case, that number 9, where I put those white streaks and white effects on the surface. This, as you can see, it doesn't have translucency to it. It's very opaque, and you have to be real careful when using it. So this is typically used if any white effects are needed on the restoration. This will be the last color, the most superficial of all the colors. And then this might be in here by mistake. I'm not sure if we have linen. I might have left that by accident. But to be honest, I'm not sure. I haven't really used and have used linen a whole lot in the past. Fissure is a color that can be used to add some pit staining, primarily on like the occlusal surfaces of posterior teeth, or certainly maybe more worn and aged teeth, older patient. You might see a little bit of this dark staining at the gingiva, along the gingival area. And then we also have a halo color. The halo, you might be familiar on anterior teeth. Sometimes you will see a bit of what we would refer to as a halo. It just kind of outlines that incisal edge and really highlights where the translucency is and basically the ending of the tooth. But I'll show you how, even without the halo color, how we can actually achieve a really kind of nice halo. It really just kind of boils down to the way that we apply the translucency. Now, some other things that come with the kit, you see on the left-hand side that bottle that's a stain and glaze liquid. This is kind of a a universal liquid for first cleaning your brush. This can also be used for diluting the stains or glaze if the consistency of those colors or glaze are not at the right consistency. You can really help dilute that down, especially if your colors have been sitting out for a while. You can just put a little drop in there, and I'll show you what the right consistency will look like. And on the bottom left, you see glaze paste. So this glaze paste, the paste is what actually is going to be used to add a layer of protection. And also, this is, as you probably are familiar with the term glaze, it's what makes things shiny. Now, what's interesting about this kit, all of the colors are self-glazing. So you'll see later when I apply the colors first, and we fire it, they're actually going to come out looking like they're glazed. But I like to utilize the glaze as a finishing layer, just kind of sealing everything in. It does shine areas that you may not have applied color to just kind of add that level of shine and protection, because you might not need color everywhere, right? So the glaze just gets you that really nice, it's a thin porcelain and thin ceramic that just kind of seals everything in. Now, also included with the kit, you'll see there's a couple brushes and a mixing spatula. The mixing spatula is super important because you really need to ensure you get the right consistency. Now, before we jump into the finishing, I first want to review the arrangement of your Vita shade tabs. Instead of normally when you get your Vita Classic shade tabs, they are arranged by chroma, which is basically the arrangement of the different colors, like A1 through A3.5, A4. But here we have them arranged based on value. And many will argue that value is the most important component to the appearance and kind of basically the brightness of the block, brightness of the restoration, brightness of the teeth is really what we would notice more. And so I think this arrangement, if you arrange your shade tabs according to value, you might get a little bit closer in the block selection for your patient. So if you choose the block based on the overall brightness of what we would consider the final outcome to be, I think that it can go a long way in resolving or easing some of the, I know, sometimes frustrations when it comes to maybe choosing the wrong block shade. But if you, again, what we're going to cover in a minute, what we're going to apply that surface characterization, then it almost doesn't matter what block shade you choose, because then now you have the ability to characterize. So I'm going to go ahead and switch over cases where you want to, where you really just want to add that extra level of touch. And this is primarily the difference between what you would get from the lab and really what is coming out of your mill. That's really the only thing that separates lab made versus what comes from the mill, the restorations and the material in their raw state. All right, I'm going to put on a mask here because I'm going to do some finishing. I hope my voice isn't too muffled. So first things first, I want to show you, this is that the TCS finishing burr. This is a silicon carbide finishing burr. And I'm going to first take you through the finishing of the sprue. So I intentionally, with BruxZir Esthetic, which this is, BruxZir Esthetic on full coverage restorations like we have here, usually we'll have 2 sprue options. So if you're not sure how to do that or change the sprue, do call into support and they can certainly help you. But I intentionally left it on the facial, and this is something that we do in our anterior course. But I want to highlight where the sprue is. So you can see the elevated, the raised part that we separate from the mandrel. It's pretty thin, but there is a raised kind of platform or base. I'm doing a not so good of a job highlighting it, but I'm using my red pencil here. And so this is really what we need to remove. And we want to eliminate all of this. And especially if the sprue is on the facial, you want to be sure that you remove and carefully blend it into the line angle, which is really, really important for anteriors. Now, another thing, especially when it comes to BruxZir Esthetic is during the milling, you might end up seeing what we call a parting line. So you can see this in the reflection. There's a little bit of this faint line here. This is basically where the burr meets when it does the incisal half, which it does second, and the gingival half. So it's kind of wherever the widest point or the height of contour of the restoration is. As you can see, it dips down a little bit, and you might see a little bit of that faint parting line. So just kind of make note of those areas beyond just the sprue itself, because if those lines end up crossing the facial or near a real visible or aesthetic part of the restoration, you want to be sure that you take care of that and eliminate it. All right, so I'm going to show you using this TCS burr, using my lab handpiece. We're going to remove the sprue. Try and do this. You can see some of the sparking here. And when we do this, we don't want to put a lot of pressure on the restoration. Just let the instrument do the work for us. So you can see we're really quickly taking the sprue down. And so we've eliminated the extended part, and now I'm really just trying to blend the area that I highlighted. It's just a matter of bringing the burr, bringing the instrument a little bit past that zone to blend it into the rest of the contour of the restoration. And so I'm going to blend this area. As you blend, wherever there's a curved area, you want to be sure that you're adapting the tool, adapting your instrument to whatever the contour of that area should be. So I can see a little bit of this raised area here. As you get kind of close to where you're intending to end up, you can always lower the speed of the handpiece. It certainly just gives you a little bit more control, helps you blend. I think the very center of that mid-facial is just a little raised, so I'm just going to return to that area. Just kind of flatten this out a little bit. A little bit of a raised area there. Whenever you get near the line angles, this is where it's really important. Crown's starting to slide, so make sure you have a good grip on the restoration. As you get near the line angle, I'm really just making sure I'm not flattening the line angle. I kind of maintain the roundness and position of the line angle. All right, so you can use the light. I'm using the lighting. Line angle still there, looks pretty good. And I'm just checking to see if all the sprue is eliminated. It looks like still just a touch of material right near the gingiva or near the margin. As you get near the margin, of course, be really, really careful. Okay, so as I mentioned earlier about the parting line, so if you see that line, I'm just going to lower the speed of the handpiece down some. You can use, again, this type of instrument, whether you're using this or a fine grit diamond, just really lightly passing your instrument over it. It should be able to remove, or you should be able to remove that parting line very, very easily. You can see a little hint of that line here too. Just a little touch, real easy to eliminate. You can see how quickly that kind of goes away. It's just a slight raised area. When the mill, which the mill uses a diamond burr, but pretending this is that burr, when we're milling BruxZir now, the burr kind of bounces very, very slightly off the surface because of how hard the material is. So it's amazing that we can end up with such a precise fitting restoration. But that's just one of the, I hate to use the term error, but it is an error in the milling. It's just the natural engineering of these restorations. So that's the finishing of the crown. So what we're going to do next, before we just jump straight into staining glaze or applying our colors, we need to sandblast, and this is just for BruxZir. So for BruxZir Esthetic, if you're staining BruxZir now on posterior, you want to be sure you you sandblast the restoration. So sandblasting, what that does for us is it's going to tone down the shine, but that's more of a byproduct to the process. The benefit of sandblasting is it's going to roughen the surface, and it's going to allow the colors and the glaze to adhere to the surface much better. Now, what I'm going to do is actually take my pencil and first highlight where we're planning to sandblast. And this is a good tip for you if you plan on sandblasting or bonding the restorations in. If you have a non-retentive situation, shorter preparation, we usually use a Sharpie in our clinic. We'll mark the inside, intaglio the restoration, and then sandblast the color away. So basically the whole internal surface we highlight, and then that just gives us a really good visual that we have effectively air abraded or sandblasted the surface. Okay, so I'm not going to turn my suction on. It's going to get a little bit messy here. It's for me to worry about, not you guys. So I'm going to go ahead and sandblast the restoration. Just going to pick a good starting point. I'm just going to sandblast. Just going to work our way down. So I'm using, just to show you, I'm going to zoom out a little bit here. This is a Danville micro etcher. There's a bunch of them out there, but sometimes, occasionally, the particles might get, might get a little clogged. So if I notice it's not sandblasting as effectively, I'll sometimes just give the unit a little tap there and continue. All right, so I've got a little pedal I'm pressing on. There's a button on the body of the sandblaster. Give a little tap, air pressure where we're at. It's a little bit low. But basically, you can see the color disappearing. That just means what's in the sandblaster, it's aluminum oxide particles. We're using 50 micron aluminum oxide. This is what the lab uses to sandblast all BruxZir restorations coming out of the lab. So this is just what we do to roughen the surface of zirconia. It cleans the surface as well. And then you'll see we end up with more of a matte finish. So that takes off some of that, what I would consider it's kind of like an unnatural shine to zirconia restorations. You can see the lingual still, actually I did a little practice round on sandblasting on the lingual, so it's kind of dull already. Again, just making sure we have a nice matte finish. Guess I can take my mask off. All right, so I'm going to use some air. Sorry, Sam, I've got someone nearby me. Hope I'm not getting any sand on you. Let me know if you need a mask. All right, so we've got our sandblasted restoration. And what I like to do after sandblasting, if I'm near a sink, which I usually am, I'm going to rinse that out. Here I've got a little ramekin and a little squirt bottle. We're just going to give this a little rinse. There might be some of those aluminum oxide particles, any dust. We want a really clean surface. So this is, anytime you are, when you use the term staining and glazing, you want to make sure you have a really clean, pristine surface, and that goes for your hands as well. So I'm going to clean this area here. That goes for your hands. Make sure you've got clean hands. You've washed your hands. Your hands are free from any oils. I'm working where I did the finishing, so I'm being real careful that I keep this nice and clean, removing any aluminum oxide from my hands. And then I'll go ahead and just dry the restoration. We'll eliminate any excess water. All right, so clean restoration is ready to go. So now before we apply the colors, now it's time to get this supported for the oven. It's going to be for the oven and also for holding the restoration during the application. So I've got a firing peg, and then there's a bunch of these out there. The one that we use is from Harvest Dental. It's called Super Peg. As you can see, it's a ceramic firing support material. So we're going to go ahead and open up the syringe. especially on really new syringes, sometimes we'll just bleed a little bit of this out. Just make sure there's not too much pressure built up. And we're going to go ahead and fill the restoration to maybe about halfway to 2/3, just a little bit, not all the way. And the reason for that is when we seat the peg into the material, we don't want for the material the excess to really flow out, and then which could end up on the external surface. Now, it is true with a little bit of space and void there, you could potentially get colors and glaze on the inside. Just be really careful to not let that happen. So the support material, you can see, even though I didn't go all the way, there's still some a little bit on the side. And if that ever happens, you can use an instrument. You can use a brush, something clean. I'm just going to push a little bit of this material away, because as I apply the glaze and the colors in a minute, I really don't want to come into contact with that super peg material. So keep that in mind as well. You also do not want to come into contact with the super peg. So we're going to go ahead and recap the syringe. This way we can keep this fresh and use it later. That can otherwise dry out pretty quickly. All right, so we've got our crown supported on our firing peg. It's supported with the super peg material. And it's a little bit more, this is more important when it comes to the glass ceramic materials like obsidian and the obsidian now. And you really don't want the peg to really come into contact with the restoration either. So make note of the margins, making sure the margins especially are away from the peg. There could be some excessive heat transfer, which could, I haven't seen it with zirconia, but certainly can be, the glass ceramics are potentially more susceptible to that. So be real careful. We want to try to maintain the support material between the peg and the restoration. So there's our restoration. We're going to go ahead and put that aside. So this is our stain palette. The colors are arranged. What we have here, just kind of a breakdown. And if you come for anterior course, this is the exact same setup that we use. So the glaze liquid, this is that bottle of liquid that we use to moisten the brush, clean our brush off, dilute the stains. This is our glaze paste. That's what makes things shiny and seals everything in. This is our B body shade, A body shade, so I don't have C and D here. And I have the translucencies kind of broken down, light gray, dark gray, light blue, dark blue. And I'll show you how we would use that. And this is the lumen. It's kind of that brightening, higher value color. And this is snow, the non-translucent white. So I'll first take you through a real simple application, what we use for Natalie, which Natalie's case, for the 10 restorations, I'm putting a little bit of body shade and a little bit of the incisal translucency, and it's real simple. On Natalie's case, I actually only used 3 colors, and so we were able to get a really nice effect from 3 colors, and I'll show you how we do that. So for our stain palette, I like to, fold up a little tissue paper, just a plain tissue paper, paper towel. This is going to be used to help me clean the brush in between stains or colors. I'm now going to get some of my brushes here. So you can see these brushes, they've been kind of sitting out for a while. They haven't been used in a while. So what I'm going to do first, and this is really important, is you need to moisten the brush. You don't want to use a dry brush with these colors. So here I'm dipping the brush in the liquid, hydrating the brush, and what I'll do is just kind of spin this around on the tissue paper. This just makes a really nice point on the brush. But what this allows the brush to do is it now transforms into a much better carrier of the color, and then the colors just kind of sit on the outside. We're not wanting the colors to be absorbed into the brush, which a dry brush would be a lot more easy for that to happen. All right, so what we're going to use, and this is important, especially with this MIYA kit, and this is something that I failed to do in my early time of using this, is we have to make sure that the colors are well mixed. And this is for each time you use it, at least each day you plan on using it. So like if we finish using it like we used it yesterday, even though the next day we've got the same colors, we're going to plan to mix the colors again, because what happens is, I mentioned earlier, this is 80% ceramic, 20% pigment, and they will naturally just begin separating. And so there's a little bit of a liquid in here as well. So if we don't mix the colors when we apply it, and post-firing, they tend to lighten. So it might appear really, in this case, let's say brown or yellow, if this is the B body shade. After we apply it, it looks a certain color, and when we fire it might lighten quite a bit if we don't mix it. So that's the importance of mixing these colors really well. So that's the B shade. What we're gonna do, and the way that we're gonna apply it, that I'm gonna show you first, I'm applying the colors first, and then we're gonna fire it like that. That allows me, and I find through teaching this process, it's a little bit easier for beginners to put the colors, and even for myself, I say it's teaching for beginners. For myself, for complex cases, I like to set the colors first, and then fire it, freeze the colors in place, and then we finish everything off with the glaze. Now, the way the kit was intended to be used is to apply a little thin layer of glaze first, the glaze paste, and then put the colors and infuse that into the glaze. But I just find that begins to layer too much, especially if the consistency of the glaze is a little bit thicker. Usually the consistency is pretty similar. If anything, the glaze might be slightly thicker, and maybe I'm not thinning it enough, but ultimately, when you use both of them together, and both meaning stain and glaze, the glaze is usually applied first, and then you infuse the colors into it, and usually that is a little more technique sensitive. And so you can absolutely work your way to that, but just to break this down a little easier, I'm going to show you first with the colors only. So if we're using colors only, what I like to do is I'm just going to pick up a little bit of the glaze liquid here, and before any colors applied, just a super thin layer of glaze liquid, staining glaze liquid. This is just to reduce the surface tension. I like to go from margins up and just kind of work our way to that incisal edge. I'm being really careful that it's a very thin layer. I want to make sure we're not pooling this liquid on here, which can make the colors spread around too easily or dilute the colors. It's just simply a very thin layer of the stain, the staining glaze liquid. So after that, what I'm going to do is apply the body shade. So I'll switch back to here. This is the B body shade. This is what we use on Natalie. A little bit of B. The base color that we're using today, this is in the BruxZir Esthetic lineup. This is, the BruxZir Esthetic Now lineup, the chairside version. This is what we call Bleach 1, which is about an OM2, OM3 color. Now, I like to use this block on a lot of my aesthetic cases because I like the brightness of the block. It has a real good brightness and value, and we just simply tone down where we want some additional hue or chroma. And so I'm going to show you first, I'm getting a little dollop of B. I'm going to first put this along the gingival margin. And then from here, I'm going to carry the color to the incisal. Since this is the first color we are applying, a little bit more of a brush stroke application is used, but when you apply stains and glaze, it's a really light touch of the brush. Really light because the brush is meant to be used as a distributor of the color. So if you see your bristles pressing, like bending too much, you're probably pressing too hard. So you can see how the color is spreading. Now, generally, you saw earlier I had this on the patient's prep, which is probably the most ideal. Just transferring it out is really difficult. What we normally do is we will set the So I'm going to show you an example through a shade tab here. It's hard to hold the brush tab and the firing peg at the same time. So if you are pretending like we're working on number 9, this is number 8, I usually just try to hold the firing peg edge to edge to the tooth we're trying to match. So that generally is pretty good. So something like that. This shade tab that I'm selecting, this is a B2 tab. So you can see we're already kind of darkening the body here a little bit. So shade tabs are generally what the lab is using, right? So if you hopefully are providing the lab the shade that we're shooting for, then if you don't have the patient there or images of the patient, the shade tab is what we'll often use as the patient and use as a point of reference. So that's the body shade. And for Natalie's case, I just put a little bit of B shade, and notice how I did carry it all the way through the incisal. I toned down a little bit, and part of that is to just fade the color up. I don't like to see a real distinct, unless you're maybe doing a tetracycline stained tooth or a tooth where the patient has bands of color. You want to be real careful of where you're stopping. So I start applying it near the margin and fade this toward the incisal edge. And this alone, and I have made restorations like this alone is already a great result. This is a polychromatic effect. If all you really needed to do was tone down the brightness or lightness of the restoration, this alone is good enough. So you don't think about having to make this too complicated. But here you can see I'm taking the color. Make sure you take it past the line angle into the contact area, because generally these areas, you don't want to miss that either, especially if the patient has a bit more open embrasure. You want to carry the color, if you are needing color, into these interproximal areas. And again, don't touch the super peg. If you touch the super peg, make sure you clean your brush off and then continue. What can happen is the super peg can be a contaminant. Any contaminants, which is basically anything that shouldn't be there, dust, residue from grinding, any foreign object that's not staying in glaze, including the super peg, if that gets infused with your colors, it can result in a rough surface or bubbling in the final finish, which we obviously want to avoid. All right, so this was, you can see this, what I applied this with, this is a number 2 brush, which out of what I have available, that's the largest brush. So larger to the brush, it is good for more coverage. So like in this initial application, that was the body shade. So we applied it over most of the restoration. And I'll be honest, I usually leave the lingual of my restorations alone. So you can already see the difference between unfinished and just some body shade. All right, so now I'm switching to a slightly smaller brush. This is a number 1 brush. And since it's a new brush, we're going to dip this back into the liquid. We want to moisten the brush. And anytime we moisten it, I'm going to spin this around on our tissue paper. Gets a nice point on there. So what we're going to apply next, you can see our 4 translucency effects: light blue, light gray, dark gray. Younger teeth tend to have a bit more what we would consider opalescence, or like a bluish tint to it. So younger, thicker enamel, the contour and the anatomy is pretty intact. And it's just the way that the enamel scatters light as it passes through. So it scatters it at a pretty low wavelength, which I'm pretty sure I'm saying that right. Low wavelength, and it's more of a bluish tint that we would see. Doesn't mean that you don't see grays, which I'll show you what we're going to do with some of the grays. But older teeth, more worn teeth, darker teeth, teeth that have chip, maybe enamel is kind of worn down, tend to appear a little bit more grayish. Now you can absolutely have both, which is why I wanted to include all 4 of these effects. And what we do is we have empty wells in the center where sometimes you mix the colors. Sometimes you just want a little tint of gray, but mostly blue. So you have also the opportunity to kind of mix them together as you see fit. But I'll show you first what we did for Natalie. So now this is the blue. Just like the other colors, I mentioned how we have to really mix these together. So mixing well, making sure that the pigment and the ceramic are homogeneous. Okay, so once we mix this together, make sure we get a good drop of this on there. And so this is basically going to outline the incisal edge and down the line angle. So I'm going to carefully drop this across the incisal. So now it's less of a brush stroke. I'm just dropping along the incisal edge, and we're going to drop this down the line angle. So I'm turning at this corner, and I'm going to work my way down first the distal line angle, dropping it, drop, 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 just all the way down to the margin. You can see that there. And then I'm going to come around to the mesial line angle. I still have let me actually pick up a little bit more blue here. And we're going to carefully, notice it's a really, really light touch. So I'm really, as lightly as I can, drop this down the line angle. And that's actually looking a little heavy. So I'm going to show you now. I'm going to take the excess blue off my brush. I'm going to dip it back into the liquid. If I see a lot of blue or colors still hanging out on the brush, I'll actually just scrape it back into the well, because they call it liquid ceramic. I call it liquid gold because, you know, these can really go a long way, and I want to preserve it as best as we can and save it. I don't like to waste the material. I'm going to pick up a little bit of the blue. If it's ever really heavy, I'll just kind of scoop up some color and wipe it away. Really carefully. Okay. So I pick up some of that heavy color. So now with the clean brush, back into the liquid, I just make sure I don't have excess liquid on the brush. And now I go back to where I applied the color and just touch back into it. Especially, what I'm trying to do is I want to, we want the colors to blend in with the underlying layer, which the initial placement, sometimes it just kind of settles on top of whatever was initially placed. And so just really lightly going back over it, it integrates it into that base layer. So you can see it blend a bit better. Any areas that I see are maybe a little heavier concentration, just lightly touching into it is going to allow the color to just kind of fade away. So you can see here on the distal where I've already passed over, it looks like it blends, it looks like it belongs, and we're just tracking down this line angle really, really lightly. And also just going back to the incisal edge, where the blue starts and ends, especially as we go toward into the body of the restoration, we also want to make sure that fades away. We don't want to see a really distinct start and end point. Now, where we might see the color carry a little bit higher, where these developmental depressions are, which is about right here and here, the developmental depressions, it's basically a little bit more, it could be a little more translucent, because there's underlying dentin extensions, mamelons and lobes that are in the middle, mesial and distal. So in between where that happens, you might see a little bit of an elevation or more translucency there. So depending on the situation, maybe, especially if the tooth you're trying to match has it, that's something you might want to consider also reproducing here. Now on the mesial, I didn't pass over it yet, so I'm just going to return to the mesial, and I'm not spreading this out really. I'm just really touching it so that it infuses with the underlying layer. I get past the line angle, and as you do this, obviously you want to be really steady. Usually I'm trying to connect my hands, so I fulcrum and try to be really steady. You know, sometimes, especially when I'm well caffeinated, I get a little bit shaky. So the shakes usually aren't very helpful. So I see it's a little heavier here. I'm just being really steady and just lightly touching into the blue. Again, just trying to get it to fade. You want to think about fading the color, letting it bleed and blend with the surrounding area. All right, so you can see how that light blue is highlighting the line angle and incisal edge. And so I mentioned there's only 3 colors. I'll show you the third color now. The third color, I'm going to use my smallest brush, my 00, and the color that I'm going to use is, I know we're kind of coming up on time, I'm going to use this dark gray. And so you could intensify the blue. Let's say you wanted a little bit more of this light blue effect, which I think is really beautiful. You could just get a little more blue and touch up certain areas. But what I like to do with this dark gray, and what I did for Natalie's, is where those developmental depressions are, I just put a drop on each, and then a little tiny drop on the line angle near the mesial and distal. And then I'm taking off the excess. So notice that initial drop is pretty heavy. But I return now with a clean brush, really lightly touch into it. And what the dark gray does, it just adds a level of depth to the area. I'm going to go to the distal line angle, really lightly kind of touch into there. And see how it blends with the underlying blue pretty well. So it's just, notice it just kind of fades in. It just adds a level of depth. On the mesial side, I'll do the same thing. And so we're using just a really light touch into it because a brush stroke is going to really disrupt the initial layer, but really lightly touching into it is pretty nice. So that's all I did for Natalie's case. And I say that's all I did, and hopefully that didn't seem too challenging, but body shade B throughout, and then that light blue, which in the kit is called Storm, light blue to outline the line angles and the incisal. So from here, I would put it in the oven. Now, this is what it looks like out of the oven. I went ahead and fired one. So this is with those colors, maybe a little lighter of the body shade than what we had. But that's the colors with the incisal and what that looks like. So you can see how that's really on the surface. Now, if we were getting this ready to glaze, I'll just quickly show you. I'm not going to put it on the firing peg just due to time. So I'm going to go find the glaze, and I'm going to go back. Since glaze is usually applied to the whole surface, I want to make sure we have the right consistency of the glaze. The right consistency is kind of a honey-like consistency. You don't want it too watery, which is going to pull and be really runny. So with the glaze, and notice how it self-glazes, the colors do, but I like to finish this off with a layer of glaze. So a really thin coat of the glaze, that's going to do a really nice protective layer. And the right consistency of the glaze is also going to make sure that you don't really have brush strokes coming through the glaze. It's a nice smooth application. So I would work my way from, and you can go from incisal down to the gingiva. That's actually where how I used to start applying it, or in this case, margin up. So there's no wrong way as long as you have pretty good coverage. Again, a really light application. And I probably wouldn't need to dilute this down. I see a little bit more streaking than I would really like. Now with the glaze here, you can absolutely put different effects in. So for example, earlier you saw the white, just to show you a little bit of white effect here. On that case earlier, there was a little bit of a streak down the center. So you can add into the glaze more colors to kind of touch things up. Just like the other colors, if you want the white to be more of a kind of this spread out effect, just really lightly touching into it, you can create that. But notice how we have this really beautiful highlight of that blue incisal effect around the incisal and line angle. All right, one more thing I wanted to show you is the, before we wrap things up, is this is that medium grit finisher. This is usually used around 7, which most polishers are like 5 to 12,000 RPM, somewhere around there. I'm going to go down to about 10, 12. And so this is a glazed application. So this had I did a single firing for the color. I did another application for the glaze. And I just want to quickly show you how this is a really light use of this. Notice how it's really shiny. This is what I like to use, a really light pressure. And this is so nice to tone down the heavy shine. And I just find this brings the finish of these stain and glaze restorations to a really nice, kind of more matte sheen, right? It's a little bit more, not matte, satin finish. So it works really, really quickly. All right, so I'm going to go ahead and switch back. Want to finish with a couple of slides here. So just kind of overall timing. You know, I usually will add an additional hour to our appointment time. So you've got the application, finishing an application anywhere from 5 to 10 minutes, especially if you're just starting out and taking your time. The oven cycle for the MIYA is about 18 minutes. So you have to consider how long it's going to be in the oven for the firing. And the reason why I do an hour is because if I separate the colors and the glaze, I just like to have that cushion, the 2 firings, and usually that is enough. Have I done more firings, and is it okay to fire it more times? You absolutely can. The materials stay same. You're not degrading the material in any way. I've done several firings in the past, so but usually I try to limit it to 2. So cool down time, definitely you want to make sure you cool the material adequately. It does come out super, super hot. So anytime I catch it coming out of the oven, I'll transfer it to a cooling tray so that the restoration can begin cooling. You don't want to try to accelerate the cooling, like dunking it in water or putting air on it. I'm supposed to say that. You're not supposed to do that. But just to test it, you may have heard of the term quenching, like taking a restoration super hot and then putting it into a water bath, which I think is still done, especially for gold restorations, just to cool the restoration as quickly as possible. I took a BruxZir Esthetic from the oven and put it in ice water, and just to see would the BruxZir Esthetic fracture, and it didn't. Glass ceramics, it's a little different story, but just something that just, again, speaks to the durability of this zirconia material. It really is amazing. So timing-wise, think about an additional hour. Just quick best practices. Sandblasting the BruxZir is going to roughen the surface. It allows the material to adhere better. Making sure the surface is clean, even after sandblasting, making sure your hands are super clean, the area that you're working in and the brushes you're using are clean. That really is the most important thing to minimize the risk of contamination. Do not overfill the material with super peg or whatever firing material you are using, because that, going back to the last statement on reducing the risk of contamination, which the super peg excess on the outside absolutely can do. Keeping the external surface clean, just another reminder to keep things clean. Consistency, the consistency of the material. You want to make sure it's easy to apply. Make sure you mix them really well, which I don't have listed here. Mix them really well before each use to make sure that they are at the right mixture to provide the effects that you're looking for. Light brush pressure, so really light, making sure you don't have the brush bristles bending too much, which usually are going to indicate you're pressing too hard. So even if your crown's moving around, that means you're putting too much pressure on it. So really, really light pressure. These brushes should last forever because you're not really putting too much pressure on them. So take care of your brushes, light pressure. You're just using it to distribute the colors. Thin, even layers. So when you're applying, just think about less is more. You can always add more color. You want to gradually build color into the restoration, which is the next point. Very easy to continue adding color if needed. And the brush sizes, making sure the right size for the purpose that you want. Bigger coverage, bigger brush, real fine tuning or specific placement of certain colors. A smaller brush is going to make things a little bit easier. All right. Thank you for your time. I'm going to check in with Helen to see if there are any questions.